A lot of people ask the question, do people really listen to their constituents? And I can say without reservation that my office and we do listen to our constituents. And this is one of those good news stories today, I think. I want to thank everybody for being here. This week, President Trump will sign the VA Mission Act, legislation aimed at improving care for veterans nationwide. Within the VA Missions Act is an important language that I included on the bill on behalf of my constituent, Charles Nelson, reached out to my office back in 2016. This language changes the Department of Veterans Affairs policy, and that policy as it exists right now denies life-saving transplant coverage to a veteran if the live donor is not a veteran. When I heard this story, I thought that was crazy. I mean, I don't know a whole lot about transplants, but I know enough to know that if you get one from somebody that is directly related to you, you have a whole lot better chance of survival than from any other kind of transplant. And when you have a situation where a son is willing to donate a kidney to a father, and the VA says that's fine, but we won't cover the medical expenses of the donor because they're not a veteran, that makes no sense. That means our veterans would have to wait twice as long to get a live donor donate, because every time they got a donor, they first have to say, are you a veteran? And if you're not a veteran, I can't do it. So we set out to fix this. And let me tell you, the Nelsons were right in there with us, and we were glad to have them. So this population that has this issue may be about 7% of our population, but it's almost impossible to find a match even at that percentage. This policy disqualifies hundreds of veteran patients, and it's already a little bit difficult because they have only 2 places they do transplants in the country, and then to be limited on the donors would be just make it twice as bad for our veterans. The way to get this done, well, you got to know how to get it done, and the best way to get it done was get it in to the big package of changes and improvements that were in the Veterans Bill. And with the help of Chairman Rowe, I was able to get my entire bill into this piece of legislation. President Trump plans to sign this bill, I think, on Wednesday. My legislation is about the 84,000 veterans that live in the 31st District of Texas and the 22 million veterans nationwide. Every veteran has had the right and has had to fight to get it right by the bureaucracy in the VA. We are a lot of what we're doing here, both by what I put in this bill and the bill itself, is trying once again with good leadership, which I feel we have locally. We are going to be getting better every day and meeting the needs of the veterans. Now, getting this done was too late for Charles and his family, because they had to go ahead and use Medicare coverage. They had to mortgage some property and put themselves right on the edge of bankruptcy in order to get this done. So they've been fighting their own personal fight while we've been fighting this fight in Washington. They've been up to Washington with us to deal with this also. And through their efforts and the efforts of a great staff in my office and my efforts in Congress, we're proud to have this in the bill. And at this time, I think you ought to hear, let's get either Mr. or Ms. Nelson up here, whoever wants to talk, and tell you a little bit about their story.
Thank you, Congressman Carter. Thank you so much. Well, first I want to say my husband is Charles Nelson. He's the veteran that needed the transplant, and Congressman Carter is the only politician of all the people that we have visited with, and we've reached out to all of our local politicians and asked for help, and he was the only one that took the ball and ran with it. So we are very, very appreciative to Congressman Carter. As I was saying my husband's, his name is Charles Nelson. He's a 100% service-connected disabled veteran with a kidney, what do you call it? Disease condition. It's called glomerulonephritis. He needed a transplant desperately in 2016. This was his second transplant. The first one we went through in 2000, and his sister donated to him. And we went through the VA process, and that process was very lengthy. We had to travel to Nashville, and it cost our family a lot of money, not counting his sister and her family being out of work for so long, but also our family having to travel. The second transplant, which we were able to, thankfully, hopefully, thought we were going to be able to use the choice program, we went through that program and we were denied. We were denied because our son was not a veteran, which was unacceptable to us. So at that time, I reached out to all of our local news agencies, all of our representatives, including Congressman Carter's office. Congressman Carter's office said that was asinine. It was the stupidest thing he heard, and next thing I know, he was trying to make a bill to change it. Well, he made the bill and he changed it. So for that, I really am very appreciative to you. My family has gone through a lot in the last 19 years, and for the VA to give us the up and down on whether or not he was going to be approved or not was extremely exhausting. And seeing our representative being behind us and helping us helped us to see through that time in our lives. I just want to make sure we also tell you about us going to Washington, which was a highlight of the whole event. Congressman Carter's office, which Nancy Pena is back here, she's an amazing, all of his staff has been wonderful, but they sent us to Washington to go with the Veterans Commission to be in front of them and to tell them our story and just watch them pass that bill. And we were very, very thankful for that, and that was just a once-in-a-lifetime event. I also want to make sure that we talk to you about the Veterans Affairs bill that they passed. That was something that should never have not been passed. It should have always been in there. And so with the VA has always tried to find a way to get around or skirt around issues, and Congressman Carter is making them meet that head on and make sure that they can't make any changes without
Oversight.
Oversight, thank you. We do appreciate Congressman Carter, his staff, everybody that has been behind us, and our community. Our community helped us tremendously whenever we needed that transplant. They stood behind us and helped us get through that time. Again, thank you, Congressman Carter, and thank you to your staff. I would like to introduce now the Director of the Veterans, Christopher Sandles. Veterans Office.
Thank you. All right, well, I want to start by extending a thank you to Congressman Carter. You know, I've been with the VA now for about 15 years, and in all honesty, Congressman, I've really never met a member of Congress quite like you, sir. And I say that for a couple of reasons. Congressman Carter has consistently shown to me that his number one priority is to seek the truth. And after he determines what the truth is, if it's not something that he determines to be acceptable, then he always takes a position of standing up for it. For that, I think the VA and I think obviously in this case, Charles and Tamara have benefited as well. I also want to take this opportunity while I have you, Congressman, to congratulate you on your new chairmanship.
Yes, sir.
And truly, I think that Central Texas soldiers and veterans just really couldn't be in better hands. And for that matter, the veterans and soldiers across the country couldn't be in better hands. So again, congratulations to you, sir. To the Nelson family, truly, you have my deepest gratitude. Now, I was not part of this healthcare system at the time that you all were going through this transplant frustration, but I did have my staff provide me a lot of the articles so I could catch up on exactly what had occurred. And I think what's important to me is that you all saw this through. That there were many that came before you that ran into these obstacles and roadblocks and just acquiesced and said, you know what, I guess this is just the way it is. We're going to have to go somewhere else to take care of what we need. What we need are more folks, whether they be staff or veterans, that when something isn't right, even if they themselves aren't going to be able to benefit from the change, that they see these things through, to be certain that legislative changes, process changes are put into place, so that those that come after them don't deal with those same obstacles. I think that's a perfect example of what we have here in the legislation that Congressman Carter's office was able to put together, and that will be part of the VA Mission Act once it has the president's signature affixed to it. But guys, I think for me, events like today are important. They're important for a couple of reasons. One, I think sensationalism is what typically sells, right? So we hear about a lot of issues, whether they be some of the issues that came out of one of our sister facilities back in 2014, or other sensational topics, and we hear about things that aren't working, but we don't always hear what happens as a result of those things that are identified as deficits in our system. So I think I was really thankful that the congressman wanted to do this press release today, because it shows that, like he mentioned, that his office listens to their constituents, that as an organization we can partner on legislation and see if we can come up with solutions that are long-term fixes. And I can assure you that 10 years from now, 20 years from now, someone may look back on this legislation, certain aspects of the Mission Act, and say that that shouldn't have ever been approved, should have never been in place. But this is how we learn. This is how we learn. This is how we improve. So this is one step forward that I think veterans for generations are going to benefit from. But I think it's also important because it reminds us that we're all on the same team. Contrary to what we may see in the media. Truly, I think that the folks that you see up here, we're here together because we're all on the same team. We're all committed to providing safe, effective, efficient, compassionate care to our veterans. But we all also have to recognize that we can't do it alone. None of us, whether it was Congressman Carter, the Department of Veterans Affairs, or veterans, that we have to work together and come up with collective solutions to move the organization forward. I mean, this is just another example today of how we've been able to do that successfully. So with that, I want to welcome you all to our Cedar Park outpatient clinic. If you have the time, we'd love to give you a tour. Thank you.